To go, Danielle.
Good morning, everyone. Welcome to our Lively You Virtual Learning Academy program. This program is on preventing falls, and I'd like to welcome Dr. Leslie Clemensen from McLauren St. Luke's Family Medicine Residency.
Okay. Good morning, everyone. I'm glad to be here this morning to talk to you about preventing falls and some of the risk factors that are associated with falls. And we do have the information that I'm going to be talking about up on the screen if you are using your camera. So if you would want to follow along there, that's fine. One thing that we want to think about as we get a bit older, regardless if we're living in our home or if we're living in an assisted living facility or with a family member, is do I have risks for having a fall? And we'll talk about some of those risk factors today, and we'll talk about how common it is for people as they get older to have falls and some of the reasons why they have those. If you're over the age of 65, about a third of those people will have a fall. And then anyone who's had a fall will typically have, I shouldn't say not anyone, but about 2/3 of the people that have falls will have another fall in the next 6 months. So there's usually a risk factor, some kind of medical condition or something happening with the individual that puts them at risk for falling. And why do we care about falls? A lot of reasons. Certainly, most commonly, fractures. People can have hip fractures or even fractures of their arms or their legs from falls. And as we get older, the incidence of that increases. In the US, we see that almost 95% of hip fractures come from someone having fallen, could be anywhere, in their home, at the store, in a parking lot, at a bank, you name it, out and about. They could have a fall that results in a hip fracture, and it's 95% of those that we see in the hospital happen as a result of a fall. And then 87%, which is huge, a huge percentage of fractures in people over the age of 65 come from falls. So it's a big problem as we get older because bone fractures can require a lengthy recovery, and there's risks with those lengthy recoveries, things like blood clots and pneumonia. And oftentimes people will have to have surgery to repair those fractures. And there's always risks associated with any kind of surgery. And the older we get, the more those risk factors increase. So these are just some of the reasons why I said is we get concerned about falls as we get older. So talking specifically about risks, if you use a cane or a walker or some kind of assistive device to help you get around in your home or your assisted living facility, you have an increased risk of having a fall. It's just that you have a baseline decrease in mobility and you need a device to help you hopefully prevent falls, but actually if you use one, you already have a higher risk of falling. And again, that kind of comes with age, most people over the age of 65. And then we do see people who have arthritis and a lot of pain. That changes how they walk and how they move, and that makes them more prone to falling. Individuals who take certain medications, particularly medications to lower your blood pressure, those are ones that can be associated with a person having some dizziness or lightheadedness, especially when they stand or they change body positions. Those are risk factors. Again, I don't want to say almost all, but it's very common as we get older for people to take blood pressure medicine to help maintain a healthy blood pressure. But some of the side effects of that is that you may have a little bit of lightheadedness or dizziness when you first stand from a seated or lying position. So those are things to talk to your physician about to help mitigate that symptom or that problem with lightheadedness or dizziness. Also, people can develop vertigo, which is usually associated with either something in the brain, it could be, or it could be just your ear. Sometimes as we get older too, vertigo is a problem for folks, and it can be intermittent. So it happens and then it goes away, and then it comes back and it goes away. And it's really hard to predict it. And so that can cause people to have a fall. A few other things to think about: low blood sugar if you're a diabetic, and particularly if you're using insulin, you have a higher risk of low blood sugar, and that can cause you to be very confused, woozy, weak, and that could precipitate a fall. Dehydration is another reason too, and that kind of goes along with the blood pressure medications. It's very common for blood pressure regimens to include diuretics or water pills. And if we're not staying well hydrated and we're taking a water pill, you can have you can become dehydrated, which can lead to dizziness, particularly upon standing, and just a generalized weakness, which could also precipitate falls. Anyone who gets acutely ill could have a fall. That risk increases as we get older, and along with that tends to be a problem with balance, and that's kind of also goes along with the use of assistive devices like walkers and canes to help you get around. Most of those folks have a baseline balance problem that requires them to use that device. And other things that sometimes we don't think about because we lose these senses usually very slowly over a long period of time, and that's sight and hearing. We don't always recognize how much of our hearing or how much of our vision we have lost, because it just diminishes very slightly over a long period of time. So it's always important to get regular eye and hearing checks, usually at least once a year, particularly if you're diabetic, for your vision, because as we get older, you can develop things like cataracts, glaucoma becomes more common as well. Diabetic retinopathy, you've probably heard of these things on television commercials and public service announcements. But these are all things that affect our vision as we get older and can decrease our ability to see objects that we would want to avoid if we're trying to walk around something. And then hearing, of course, does dwindle usually as we get older, and that can sometimes increase our risk for having a fall. So today I want to talk more, now that we kind of know what some of the risk factors are, we want to talk more about preventing falls. So what are things that you can do in your own home to help prevent a fall? There's a lot of things to do. We recommend that if you have rugs in your home, that you get rid of them. They actually, although we like to have a rug to catch the water and the mud and all the dirt that can come in from outside, it's not necessarily the best thing to have in place especially if you're using a walker or a cane. It's easy to catch your foot on the corner of a rug and then down you go. So rugs are a big deal, particularly if you're using an assistive device. We recommend that you don't use them. Uneven floors. Older homes, very common that they kind of have settled over the years and the floors may be somewhat uneven. So if you have those things, looking at fixing that or repairing that to help with just mitigating that trip hazard is always a good idea. We would like people to use grab bars and handrails as much as possible, particularly in your bathroom environments. It's just a great way to have a security there, particularly in showers and tubs where things are extra slippery because of the water. So those are really important. We also think that, or we also know that having good lighting, again, if our vision is declining over time, even with glasses, having bright lights so it makes it easier to see. Those are things that we want to make sure are in place in your homes and your assisted living facilities. So Other things that are risk factors that we talk about, but you kind of need, are things like electrical cords. It's really common to have televisions, radios, lamps, any of those kinds of things that you would use in your living room or your bedroom. They all need an electrical cord. The problem is that we never want those to be in a walkway, because they're a trip hazard for anyone, but especially if you are older and you're starting to have some issues with balance and mobility. Those are a big no-no. We want them tucked into the corners and make sure that they're just not in any area that you would normally walk in. Another risk factor to talk about too is people who have pets in their home, particularly smaller dogs, or even cats. I've heard of people tripping over their cats. Usually tends to be the smaller dogs, but that can be a hazard for a fall. They get excited, they're underfoot, you don't see them, or they just make a sudden dart across a room in front of you or something like that. And you can trip over them, and that can cause things like, as we discussed, hip fractures, leg fractures, arm fractures. So just important things to think about, to have, to avoid in your home, but then also to have available, like having grab bars and handrails. Other risk factors, as we talked about earlier, blood pressure medications, those kinds of things. There are other medications with side effects that are not necessarily blood pressure medicines, that can cause you to feel really sleepy, really tired. We talked about dizziness as well as a side effect of medication, and dehydration. And there are possible side effects of medications that some of them can cause confusion. And these are all definitely, factors that can contribute to a fall. So those are the things to watch for as side effects of medications, and to know, if I take this medication, this could happen. So I need to be prepared for avoiding certain activities. If you're really sleepy and fatigued because you took Benadryl or something, it's good to know that can make you feel that way. And so that's not a good day to plan a lot of activities. So just recognizing what those medications can do is really important. Besides medications that can cause bad side effects or precipitate a fall, there's a lot of important medications that we talk about for maintaining the health of your bones, particularly in women that are older. Men can also have this issue, but it is more common in women, and that's osteoporosis. I'm sure you've probably heard that term before. Means a porous or a bone that's very holy, I guess. So we know that as we get older, the bone weakens over time, and it can make it easier for that bone to break. In fact, there are people who have just spontaneously broken bones because it was so weak from osteoporosis. So most important thing is regular weight-bearing exercise. And when I say weight-bearing, I mean just walking. Something like walking is a great way to do weight-bearing exercise to help strengthen and to maintain the strength of our bones. There are medications and supplements that we should take if we have osteoporosis. And especially as we get older, as we women get older, you should be taking a vitamin D supplement and calcium supplements to make sure that your body has enough of the resources to keep your bones strong. And so along with that, there are medications that help strengthen our bones that we take for osteoporosis. Some of them are pills, some are actually injections, some are infusions that we can get. So those are things to talk with about your primary care provider if you're at risk for osteoporosis. So as we discussed a bit earlier, eye health and vision is extremely important. And I think I mentioned having your eyes checked every year is particularly important as we get older, to make sure that your vision is optimized and that your glasses are appropriate. The prescription is appropriate for your vision. some things as simple as cleaning your glasses. I can't believe how dirty my glasses get throughout a day. So it's really important to make sure that you take the time to clean them. Usually once a day is fine, but they can get very dirty just from the environment and from the oils in your skin, and it's important to make sure that those are clean. We talked about lighting as well. Good lighting in the home, having bright light available, opening curtains and shades so that you can see well in your home and not be tripped up by something that may inadvertently be on the floor. When it comes to canes and walkers and other assistive devices, you should make sure that they're in good repair. You should know how to adjust them appropriately if they need to be fitted to your height. Those are important things so that when you pick them up from the store or from the pharmacy, that they've been fitted to you and that they're working well and you know how to take care of them. They're clean and easily adjustable if they need to be. Another important assistive device that we haven't talked about is shower or bath chairs. These are great once you have handrails and things in place in your shower or your bath. Having a chair to sit on to bathe or take a shower is extremely helpful, because then you really don't have to worry about falling while you're doing that activity. And then it's easy to transition, or easier to transition from a chair to the edge of the tub and then stand from there using your grab bars and your handrails that you have available. So these are probably some of the most important things to think about when we want to talk about preventing falls and knowing what our risk factors are for falls. So these are things that we actually, in our office, when we see our patients, each visit, we assess whether or not they've had a fall recently, and do they have risk factors for falls, so that we can help make them aware of things that need to maybe be changed in their home or their assisted living facilities, so that they're safer and they have a decreased risk of having a fall in the future. If you want to go ahead and take a look, I think at the last page, there's actually a questionnaire about falls. Now, we don't do this extensive each time a patient comes into our office, but if you look briefly at the questionnaire, it's about 10 or 12 questions here about: have you had a fall? Have you been asked or you've been advised to use an assistive device like a cane or a walker? Asked about feeling unsteady or unbalanced while you're on your feet. Do you have a fear of falling? That can actually increase your risk of a fall. If you have a loss of sensation in your feet, that typically happens with people who have long-standing diabetes. That's a big risk factor for falls. Incontinence or urinary urgency is a big deal. People get in a hurry to get to the restroom, and that can precipitate a fall. And honestly, if you look through this, there's a lot of questions, but it only takes a score of 4, which would be 2 yeses out of those questions, to indicate that you have a significantly increased risk of having a fall. So if you want to take the time to look at that, when you have some free time, it'll just give you some ideas and some things to think about when you are considering fall risk and how to prevent falls in your home. Does anyone perhaps have any questions?
Perfect. I don't see any questions in the chat feature, but then
Okay.
I'm going to go ahead and allow anyone to ask questions. Be mindful that when we do ask questions, that we just share the details and not get too extensive into some of our medical concerns. Anybody have questions? Carol, looks like you have a question. I'm going to ask you to unmute yourself. Oh, you're still muted, Carol. Can you unmute yourself, Carol?
Okay. Can you hear me?
There you go.
Is there any place that you can get or borrow like a walker or something like that?
Absolutely. In fact, I just was on a phone call with this organization earlier today. It's called the Ability Center. They are located in Toledo. They actually have some branch offices outside of the city as well. They rent assistive devices, wheelchairs, canes, walkers, shower chairs, bath chairs, ramps, etc.
Okay.
Just as well, we loan them out
Oh,
for
good.
free to anybody in Wood County. So we have an extensive closet.
I was going to say, you can always call United Way at 211, and they have linked to a lot of different free services as well.
Yes. Yep. There's a lot of resources out there for that kind of equipment if you do need it.
Is there a time limit on how long you can rent them?
Ours is for 6 weeks, depending on the issues or concerns. So, yep, just depends on what's needed.
Okay.
Any other questions?
Do they have a number for the Ability Center?
You know what? I don't have it on me right this second. Do you Google, Carol?
Yes.
I would just Google the Ability Center.
Of Toledo?
Yep. And also you can likely call, as Tony was saying, you could also check with United Way and see what their rental.
And as well, Carol, you can use us as
Okay.
well.
Yep.
Right. Any other questions?
Many years ago, my mother, who's no longer with us, was able to obtain some equipment from, I believe it was called the Sight Center. She had macular degeneration really bad. And I don't know, I forget what kind of equipment she got, but I don't even know if that place is in existence. You know, I'm going back to over 20 years. It is?
Yes.
Okay. And what kind of equipment would they have to offer?
It's all site related, and they would have to do an evaluation on an individual to determine what type of adaptive equipment might best suit them in their own homes.
Okay.
All right, Julie, did you have a question?
No, I just got done getting my I have to do the screening every 2 years, and they just put me on medication that makes me really sick. But other than that, it's a once a week medication I have to take for the osteoporosis to keep it from getting accelerating, I guess.
Exactly.
And I take it on Sundays. So that's the day I do the least amount of stuff, and it's like the first part of the day I'm really nauseous, and the rest of the day I have a headache. But then the next day I'm okay. So
You're okay. Okay. Yeah. Unfortunately, the pill form of the medications, they're called bisphosphonates. They can upset your stomach, and we ask that you take them actually on an empty stomach before you would have any other food. But 30 minutes after you take it, you can have something to eat if that helps with your stomach upset. But yes, it's usually for the most part, pretty well tolerated. And there are options for taking the medication on a daily basis too. So that's something you could check with your provider about to see if that helps with your symptoms.
okay, thank you.
Mm-hmm.
All right, any other questions? Okay, wonderful. Well, thank you so much, Dr. Clemensen, for joining us today.
Sure, pleasure to be here. Thank you, guys.
Yes, your information on fall prevention, and stay tuned. We will have many more programs from McLauren St. Luke's Family Medicine Residency Program in the future. So thanks again, everyone, for joining us today.
Thank you.
This is Danielle, right, at the Senior Center?
Correct.